Our keynote session panel today is The Power of Health System Collaboration, Partnering for Community Wellbeing and Prosperity, featuring Cleveland Clinic President and CEO, Dr. Tom Mihaljvic, and University Hospitals Health System CEO, Dr. Cliff Megerian, and is moderated by Rachel Woods of the Advisory Board. Ohio communities benefit when organizations collaborate to bring stronger solutions and strategies to address our most pressing challenges and opportunities. The collaboration between Cleveland Clinic and University Hospitals Health System has improved the well-being of the communities they serve, including battling the opioid epidemic, expanding research, improving talent recruitment, and bolstering training of caregivers. I'm going to turn it over to our moderator, Rachel, to begin today's keynote session. Rachel?
Thanks, Mike. Tom and Cliff, it is so good to be speaking with the two of you again.
Good to be speaking with you, Ray.
Always good to see you.
Now, I always like to ground these conversations in how things operated prior to the COVID-19 crisis. When I think about your two institutions, the Cleveland Clinic and University Hospitals, I think of two pretty fierce competitors, right? You both operate in the same market. You're both academic medical centers. Frankly, you're two of the largest employers in the state of Ohio, let alone just Cleveland, and you're both focused on growth. Give me a sense of how your two organizations operated in normal times. Cliff, let's start with you.
Well, I think I could be honest in answering this question. We have to define normal times as really before Tom and myself getting to know each other and becoming friends, and then before COVID. But I would honestly say that we actually first met when I first came into being prepared for this job, actually before COVID started. And I think we both got together and said that both organizations need to find a way to work closely together in areas that will benefit the community. Meanwhile, while we still try our hardest to, in essence, compete clinically to provide the best value for our population. And I think it resonated to me that Tom Mihaljvic felt the same way I did. So I'll be honest, the before was also a new relationship that came, and it was juxtaposed to two new leaders finding a compatibility.
Tom, how would you describe this before the two of you came into these leadership roles, before the greatest crisis of our time came about? How would you describe the relationship with your two institutions?
Well, there's obviously different times, and you're absolutely right. University Hospitals and Cleveland Clinic competed in a ways that most large organizations compete. They're trying to provide better service than their competitor. And from that standpoint, competition is something that we should welcome. And we welcome it and we endorse it because I do believe that both organizations get better by having a formidable competitor nearby. And ultimately, it's not about just us getting better. Obviously, the primary benefit from competition is I do believe that our patients are those who benefit because we do improve our services, improve the type and the access to care that they deserve. So yeah, that was the time of intense competition, and we continue to compete in the areas that are important to our patients and important to us. But it was obviously during this COVID pandemic, we have identified a lot of different ways to collaborate for the benefit of our communities.
And if I have the story right, I think the decision to come together and find areas of partnership happened kind of serendipitously before the crisis actually happened, before it became really necessary to come together. Tell me, how did that decision happen? How did you actually come together and say, let's find areas where we can partner?
Do you want to go first, Tom?
Sure. Yeah, it wasn't that complicated. I think oftentimes people would think that it has to be some master plan and then it has to be a big meeting in order to get those things across. And it really wasn't that complicated at all. Cliff and his predecessor, Tom Zenti, and I, we simply sat together and said, well, there are areas that are really important for our communities, areas where we can collaborate around, for example, around workforce, around employment, around opportunities to provide the ways for meaningful employment of people who reside in our communities, areas where we collaborate, such as research and education and attraction of talent in Northeast Ohio. Those are the obvious synergies. We also identified synergies around supply chain, the procurement of goods that both of our organizations need. And it was easy to come up with that list. And then the next step was actually to introduce our teams to one another. So University Hospitals and Cleveland Clinic executive teams have started a little over a year ago for the first time, I believe ever, to meet together and not only discuss the opportunities, but actually put words into action.
And I'm very intrigued by this initial spark. And before we get into the details, I kind of want to come back to Cliff, who mentioned that this moment came about with a leadership change. As leaders, was there a mindset shift that you need to have walking into a dinner with your closest competitor, or a shift that needed to happen to say, despite positive competition, we need to work together? Is that something that had to click for you?
Are you asking me, Ray?
Yeah.
You know, I think every leader brings to the table their experiences and their training, and more importantly, their attitudes and viewpoint. And I'm a student of history, and history has proven itself over and over again, whether this century or the thousands of years before, that ultimately the best outcomes occur when two, if you will, competitors don't stop competing, but frankly, find ways of enhancing the relationship to better the environment around themselves. And this happens with nations, it happens with companies, and now in this case, it happens with hospitals. So I had that mindset. I was very pleased that immediately I saw that Tom had that same mindset. So I think it had to start at that level, because I think that was the key. And from that, we both lead our organizations, and we were able to, if you will, motivate our folks to feel the same way and begin on their own in earnest, working on even more clever ways of collaborating. And I think Tom gave a very nice opening list, but that list has expanded to things like maybe even central sterile supply. It's expanded to how we are dealing with the opioid crisis and responding, if you will, to funds that made available through settlements. We had no expectation there would be a global pandemic, which really required three phases of first reaction, testing, housing patients, and then vaccinations and load balancing. And we ultimately learned so much from each other because everyone has great minds. So it was a series of serendipitous events, but it started with a shared mindset that great organizations do better by collaborating in areas that they don't necessarily compete.
And I think that shared mindset is also reflected in who the two of you are as leaders and frankly, as clinicians, right? You're both physicians, you're both surgeons, you are both used to working with your peers in the hospital, in the OR, and it makes sense that you two would reach out to each other in a business sense too, because frankly, I think that's part of the DNA of being physicians. Tom, you mentioned kind of the starter list of areas that were non-competitive in nature that your two organizations could partner on. How did you actually decide on that starter list, or who was involved in deciding this should be the area that we start with?
Well, there are only really three people involved in that discussion. And once again, it was not really an elaborate setup. It was Cliff's predecessor, Tom Zenti at the time, and myself. We said, okay, let's just think about areas where that could be of mutual benefit to both organizations, where there is nothing to be lost through competition. And, even before we started compiling a list, I think the most important step is the one that you actually outlined. It's just simply understanding that competition and collaboration are not two exclusive issues. Those are, this is possible to compete and collaborate at the same time. And then we went down a list. Okay, what are the areas where we can really nicely collaborate? And then we identified those that Cliff and I already mentioned at the time. the top of mind was actually opioid crisis. And I'll just use that as
the last crisis that we were focused on that obviously hasn't gone away.
Yes, it hasn't gone away. It is still here. It has been overshadowed by COVID pandemic. But it was clear to us that in order to take better care of our communities when it comes to opioid crisis, we have to collaborate. We have to share data. We have to share practices. And we have to get a better understanding of how can we jointly use the resources that are finite for the benefit of our communities. And I think we learned a lot in the process, and it just triggered our collaboration and brought on all those other areas where we collaborate today.
So the starter list was pretty easy to come about. It's kind of the obvious areas that are very clearly not competitive. COVID-19 certainly added to that when it comes to testing, vaccination, and so on. Cliff, you mentioned that was just the beginning. Have you added any areas of collaboration since that initial starter list?
I think we have, and I think Tom very eloquently described a new concept called cooperation. It's a word that's being bandied about in management and leadership circles about the concept of that there is no mutual exclusivity as it relates to competition and cooperation, that in fact, ideal organizations meld them together into this word called cooperation, which is being bandied about as a new management term. But going to answer your question specifically, we also realize that, yeah, we compete in research, for example. We do. Obviously, each of us wants to have the best research portfolio, whether NIH or private funding. But we also realize that many of the larger grants that we're competing across the nation with in the NIH program project awards, U awards, that in the end of the day, we're judged in essence by the breadth and scope of the principal investigators. And so, for example, in a cardiac grant that we just together were able to land, it was because we both realized that, yes, we can go in individually on that, but we'll have a better chance of getting it if we bring the best minds together. And we don't do that all the time. We can't do it all the time. But whenever we can, we are trying to do that because the rising tide floats all boats. So these are new areas that we're looking at. We looked at things like laundry. We're looking now at perhaps against other, if you will, staples and table stakes like central sterile supply. So I think the good news is now we've set up a mindset of innovation as it relates to cooperation, that we are going to look at all the different possibilities that arise. And so, no, I'm very, very excited.
Yeah. And that research example is such a good example of cooperation, right? Where it's not just something like laundry services where there's clearly no competition, but it's an area where you can say, we need to bring these dollars to Cleveland, not necessarily to the Cleveland Clinic or to university hospitals. I'm curious, as things have evolved, you've added to that list. Has anything come off the list? Did you go down a path and then realize, you know what, this actually isn't quite working the way that we thought it would? We need to take this off the list for now.
No,
Tom,
we have not
you're
really
shaking your
taken.
head.
We have not really taken anything off the list. What we have realized is, that certain initiatives obviously have a different life cycle. Certain projects have a very, very long lead, and we're going to see hopefully the fruits of that collaboration a little bit down the road, maybe in a year or two, when we speak about the large research projects or when we speak about the job creation and so on. But, some of them have a shorter life cycle and we see the fruits immediately, but we have not really taken anything off the table.
Yeah. So maybe it's just the prioritization has shifted.
I'd add that, the luck and good outcome comes to those who are well prepared. In other words, there's luck, and then there's outcomes that could be ascribed to luck, but come from preparation. I'll use an example that I think Tom gets a lot of credit for is that, we had no idea when we were meeting in February of 2020 that literally in a year to 16 months, there would be an opportunity to have this gigantic grant from Jobs Ohio. But the success of acquiring that grant would be at the very least, the successful collaboration of UH and the Cleveland Clinic as principal drivers of a 5-party including Case Western, Cleveland State, and Metro, a 5-party collaborative to apply as opposed to apply individually. And so I think we had primed the pump in terms of not necessarily worrying about it where every nickel and dime are going, but being the goal being the attainment of that grant for the betterment of our community. And I'm not saying that was envisioned when we met and created the if you will, the points at which we'd collaborate on, but it was because we've developed the comfort and, more importantly, a trust with each other that went swimmingly. And as you know from the announcement from Governor DeWine, it was a fairly substantial investment on behalf of the state and Jobs Ohio in many efforts that each of us are participating in.
So you made the decision to come together, right? A little bit over a year ago at this point. You also came up with that starter list of areas where you either were non-competitive or fit into this kind of cooperation mindset. But I have to believe that those are actually the easy steps here. When it comes to creating kind of connective tissue between two separate organizations, let alone two competing organizations, that's where I think the rubber hits the road. Tom, can you describe for us what is the process that needed to be put in place so that your two organizations can be working together towards these shared goals?
Well, Cliff's and my responsibility, our shared responsibility, is essentially just to establish a framework for the collaboration and to introduce teams to one another and to the largest extent possible lead by example. And then the rest is really on our teams, because in the roles that we occupy, we cannot do everything ourselves, and we cannot follow every initiative at a great detail. But what we can do is we can enable our colleagues, our teams, and encourage them to work closer together. And I think that's really, really important, a responsibility that we carry. So once that is established, then there's very little resistance. I have to say, people naturally like to work with one another. We live in the same city, we go to the same restaurants, we root for the same teams, we are neighbors. There is really no resistance there. Yeah. The only thing that one needs to overcome is this kind of almost historical mental threshold that tells people for no good reason that large organizations and people who belong to large organizations have to be completely separate and not united. Mm-hmm. And that is really what we simply needed to overcome. And it is really not that complicated.
Yeah. I totally agree on kind of setting the cultural standard for collaboration, not just at the top, but at every level. Cliff, I wonder if you can describe kind of the process that was put in place. I mean, do the two teams meet? How regularly? How do decisions actually get made with two different organizations?
I think after we met, there may be a couple other phone calls and emails between Tom and myself, and then what I did, and I want to speak for me and not Tom, but what I did is then I pulled in the leads, who would be the leads of those verticals, and had a discussion. First, made sure that I wasn't dictating, but they felt that that this made sense. And once the team and the board and our board chair felt this was, frankly, not only made sense from many corners of our community, at least I heard, and maybe Tom could comment, that this is something the community had been longing for, both from a leadership standpoint at the city level, the county level, and the community as a whole had been longing for. So I think that gave a little bit of wind to our sails. So then I sat with the leaders of the 6 different verticals that got started. We put together a team, and Tom was kind enough to really, I think, made some aspirational timelines. And we were to meet in a month, which we did, I think, by March of 2020, obviously Zoom, properly distanced. And we set some aggressive timelines of having some do-outs. And we have been meeting. Our next meeting's in June. I know we're working to schedule that right now. We had our last meeting just a few weeks ago. and that began a cadence of every 2 to 3 month meetings, where there's actual very impressive do outs and deliverables now being delivered, whether it's in the job front for job creation and underrepresented minorities, and entry points into our organization, both organizations, or whether it be applying for funds, opioid funds, to do projects together. We really have, both of us executive have expectations that this is not just a fun exercise. This is part of our business now, and I expect real outcomes. So I think we had to get the hearts and minds. Once we had the hearts and minds, we developed the why, and then this is now existing as a part of our business.
Yeah, absolutely. I couldn't agree more that it's the combination of the hearts and minds and getting folks aligned and kind of moving in the same direction, coupled with, it sounds like, a very robust process that includes discrete goals that members from sort of both sides of the aisle can come out with every 2 to 3 months when this team meets. When I think about the ways that the two of you can help other leaders in Ohio, I often find that other leaders benefit not just from hearing from how things have gone well, but also from hearing about the barriers or the biggest struggles that have happened. So if you think about your journey across the last year plus, is there anything that actually went wrong that you want to advise the leaders listening to this so that they can get it right? Tom, I'll start with you.
We have not really, in all transparency, had, at least from my perspective, had really any barriers in our collaboration. You know, as Cliff mentioned, probably one of the biggest accomplishments of working together, not just at UH and Cleveland Clinic, but also with our partners here with Metro, Case Western Reserve University, and Cleveland State, was in getting the big grant from Jobs Ohio and State of Ohio. This is the largest economic investment in Northeast Ohio, and the largest economic investment in the state of Ohio. And, you know, that was a really important deliverable for us. So we pushed it really, really hard. We knew that we want to bring this across. And of course, when something that important takes place, and when there are so many parties involved, there are always going to be areas where we disagree. And that is perfectly fine. This is something that we invite and encourage. Constructive disagreement is a good feature of every collaboration. And I would say one thing that we've learned is whenever we had a constructive disagreement, or when there were areas when we thought that we were not appropriately represented, or that one party in an argument were not properly treated, we simply openly discussed it. And I think that was really very, very helpful. What I have to say is that the first step for our collaboration of 5 large organizations was to establish the framework, Why are we doing it? What do we want to accomplish? What are the basic rules of engagement that we all are going to agree upon? And then anytime when we had this minor disagreement, we were able to sort them out in direct conversation. And through that, we did not alienate one another. We became even better friends and collaborators. And ultimately, what is probably the most important thing, we earned the trust of our state and Jobs of Ohio, and received a grant that is going to, we believe firmly, transform Northeast Ohio.
Yeah, well, I appreciate that as a lesson learned. Maybe it's not a mistake, but the lesson learned is to have a clear purpose, get buy-in and build trust around that purpose, and then make sure you're holding that sacred, which might mean allowing for reasonable disagreement and reasonable discussion from all parties. Cliff, I'm going to ask the same question to you. Is there a big lesson learned, maybe a stumbling block that you or the team more broadly had to overcome that you want to share with leaders listening to this?
You know, I think since this was fairly new, at least going back to the relationship between UH and the Cleveland Clinic, you know, the first stumbling block, I think, in any facsimile of such a arrangement really comes at the level of developing trust. And once that trust is developed, whether it takes one dinner, three dinners, a bunch of meetings, is that once there is trust, then I think the leader of the individual entity needs to remind folks who may be naysayers, doubters, that let's start with trust. And then let's if there is something that goes wrong because we have this trust, or there is a disagreement, that we can hash it out openly and transparently. But I think that that is the biggest lesson learned, at least for me, in this and in other arrangements, is that it really starts at the top. Unfortunately, it has to start at the top, and that you have to spend the necessary time. It's like diplomacy between nations. There has to be some level of trust, so that from that point forward you can move, and then you could verify if necessary. So I think that is my lesson learned. It's not going to always, there's going to be disagreements, there's going to be confusion, but if you have open channels of communication, the ability to question without appearing as though one is suspicious or hostile, then that process will continue, because both sides will want to rectify any misunderstanding. So, but it starts with trust, and the other things I mentioned follow in line. It's just normal human behavior.
Mm-hmm, mm-hmm. You know, I'm cognizant of the fact that I started off this conversation by describing Cleveland Clinic and university hospitals as competitors. I think I actually used the word fierce competitors. But as both of you have said, competition isn't necessarily a bad thing. And up to this point, we've been talking about the partnership angle, the non-competitive areas, or the cooperation areas. But my question is, has the partnership changed your ability to actively compete in a positive way with one another? Cliff, let's start with you.
You know, I don't think so. I feel pretty confident to tell you no. I mean, and again, I think Tom will remember that we actually had this conversation the first time we were together. We're obligated to compete with each other, because as it relates to providing excellent services that promote efficiency, services that are differentiating, that's what the community expects from us. And so it should not in any way create any sort of quid pro quo, whereby our desire to be innovating medical care, medical discovery, and medical delivery would in any way be buffered, if you will. That would not be what we should be doing and what we should do. So in my opinion, we will obviously continue to compete for the betterment, really, of the community. Cleveland Clinic will do things tomorrow that we never thought of. Hopefully we'll do things that maybe they didn't think of, or maybe both of us thought of it, but one will get to the table faster. That's what it's all about. So I can honestly tell you that I didn't expect, nor should I, as a leader, that aspect of my duty would somehow be mollified.
Yeah, Tom, I'm curious to hear what you think as well. And I know that this partnership has been going on for a little bit more than a year. You know, if you've been able to successfully still compete, I wonder if you can share some ways that your two organizations have continued to use that competitive spirit to your individual advantage while keeping up this partnership.
Well, we're competing not necessarily to our individual advantage. We are competing to the advantage of our patients. That is really why competition is so important. And I would like to share with you that it is not just Cleveland Clinic and UH who are collaborating and competing at the same time. During this COVID pandemic, if you watch carefully about the healthcare landscape in the entire country, we have been able to bring together fierce competitors when it comes to the provider side that were united around a common cause. You know, we have collaborated with all of our competitors, from Mayo Clinic to Mass General, across the country, and we were united around the initiatives that were started in one organization here in the United States, or two, and for example, around masking, around advocacy for the better structured of COVID trials, around vaccination. Those were unifying moments for healthcare industry in the United States, where competitors decided that we have to get together to add much needed credibility, much needed credibility and trust behind the causes that are important for every American. And that is really what may have started here in Northeast Ohio, but I do believe that this is a practice that is now not just limited to our state. It is becoming a well-embraced practice in the United States. And so we had a number of different and very important public campaigns during this COVID pandemic that we were able to start and motivate others to join. And I do believe that we have helped people understand certain healthcare issues that are very, very important in our times better. And we were able to do it because all of us joined behind those important messages.
And you know what? It's a fantastic push to our listeners in the audience that might be thinking, you know, I haven't sat down with the other CEO in my community, or the executives that I work for haven't come together like this, or might be thinking, gosh, I wish I had a process where teams from multiple institutions could get together every 2 months. But to your point, there probably already are ways that these, you know, all organizations across Ohio and I hope across the country have been working together across this crisis. The key is to take this moment to think about, how do we make it last? And how do we make it last in a purposeful way that helps our patients and our communities?
You know, the collaboration that has resulted from all the hospitals here in Ohio working together with the OHA on really putting down their egos and understanding if someone across the street or across the county or across the state has a better way of running a vaccination scheme, a better way of processing testing, or a better way of load balancing patients, we are all sharing those, probably better than we've ever done before. So I think you're right, Ray. There's going to be a pre and post-COVID world whereby I think going forward, we are going to hopefully be able to bottle and capture this level of not just UH and the Cleveland Clinic, but I think, as Tom mentioned, what people can learn from us around the nation, but more importantly, the state itself, how the notion of always looking to learn from, let's compete, let's try to get to first base first, but if we don't get there, let's learn what the other one did and maybe even borrow it from them, pay them for it, like whatever it is to make our patients better. And I think that's what I'm seeing a culture develop, at least in this state. I'm not privy to how the meetings go in other states, but clearly I think we are adopting a new framework of collaboration and mutual learning.
Well, and if you think about a post-COVID world, this is also something that the leaders listening to this have complete control over. You don't have to say, well, what's going to happen with telehealth reimbursement? Or I don't know how the next round of regulations and policies are going to affect, you know, how much APPs can practice. Deciding when, how much to partner and creating the framework to do that is something that you have complete control over. So why not make that part of the post-pandemic strategic plan? I want to take a moment and actually come back to the two of you as people and the two of you as leaders. I do think that it is unique that you were so willing to come together, set up that first dinner and say, let's make a plan. Again, even before the crisis demanded moments for you to do so. As you've gotten to know each other, as your organizations have gotten closer, what has changed about you as leaders? Tom, let's start with you.
Well, I believe that there is a greater degree of comfort. Obviously, there is a trust and a friendship and collegiality that we've developed individually, but then we certainly hope, and I believe that we're seeing it in action, that this is translated into the similar feelings among the members of our team and our broader community, so to say. And I think that is really, really comforting. I would encourage every person who listens to this to really strongly consider the strengths of collaboration. I cannot think of a single instance in any areas of public life where collaboration has taken away from an individual value of a company, organization, entity, or a person. It has always just really helped us achieve more and help us achieve faster and in a better way. So for me, I think there is just even a greater comfort and greater enthusiasm about a collaboration in a much broader arena. So those are the lessons that I've learned.
Cliff, what's changed about you as a leader?
Well, I think I've become a better leader because when you decide that you are going to have, again, as you mentioned, a history of fierce competition, a history of perhaps organizations not necessarily want to adopt what the other competitor did out of whatever pre-existing attitudes were available. I think I've become a better leader because I am willing and very readily want to learn, if you will, from the successes, not only of Tom, but of other leaders around the nation. The notion of being open and constantly looking for better ways to improve either myself as a leader and my organization by looking at organizations previously viewed as competitors allows a whole vista for you. And I think the second way is, and this is more relationship between UH and the Cleveland Clinic, I think this has allowed tangential activities to move much easier. So for example, last week or the week before, Tom gave me a call about something that he suggested we do together. I would say that in the past, that would have required meetings, board meetings, all sorts of detective work to discuss what is the ulterior motives and somewhat 007 kind of activities. But basically, he called me. I said, that's a great idea. Count me in. We're all in. And that was the end of it. I think that is a potentially, now maybe that would have happened anyhow, but that is potentially a positive side effect of our tour. And imagine if that was happening in other municipalities. And this is a non-competitive area. There's an area that's going to better our community and frankly, our nation. I won't get into the details, but that was a positive change for the organization. And I can't honestly say that if it wasn't for a collaboration, it would happen within a 10-minute phone call. And imagine how many other 10-minute phone calls could be happening if organizations similar develop those relationships. And not more importantly, the phone call, just deciding to make that phone call. I'm sure for Tom, I don't feel problematic picking up the phone like in an hour if I have something I want to discuss with him. But the ease of that communication being facilitated also is something that you got to put a price tag on. That's a valuable asset.
Mm-hmm.
So
that only comes from the trust that the two of you have been describing throughout this conversation. Absolutely. I want the two of you to cast ahead 5 years from now and tell me in 5 years, what do you hope the story of Cleveland Clinic and UH is? And what will be most critical to that becoming a reality? Tom, what do you think? 5 years from now, what's the relationship between Cleveland Clinic and UH?
I would like to believe that in 5 years, we're going to be at a point where people will be looking at our relationship as a model for nonprofit collaboration across the United States. For the collaboration nonprofit organizations throughout the United States, I do believe that this could be a transformative movement for healthcare in general in our country. There are thousands of hospitals in the United States that do not work in synchrony. And there are yet these well-defined areas when all of us can, without any doubt, meaningfully collaborate to the benefit of our population, to the benefit of our patients and our communities. And I think our country would be far better off if every nonprofit healthcare organization would have as a part of its mandate a collaboration in the areas that we just described. Through that collaboration, I would like to envision that 5 years from now, we're going to have a healthcare system in the United States that is going to have a wonderful balance between individual excellence and shared responsibility for the advancement of health of the populations that we serve. And I do believe that we would become a much more flexible, much more resilient healthcare system. We would become much more cost effective. but probably the most important thing, we would alleviate more suffering and save more lives and improve and advance health and wellness of people who count on our services. I do believe that what we've just discussed is an illustration of how much good can be made through collaboration.
Cliff, what's the relationship 5 years from now, and what's the most critical step to getting there?
I think Tom said it well. My hope would be that the fruits of our work, what we get right, will be ultimately delineated. Perhaps white papers will be written, boards of collaborating, if you will, healthcare organizations will make it part of their mission to ensure that these collaborations take place. I mean, let's be honest, we're spending close to 20% of our GDP on healthcare. We cannot let it continue to rise. I firmly believe if the fruits of these activities were furthered and then became part of communities that have multiple competing health systems, that we can work together to even find ways of, number one, lowering the overall cost of care, improving access to care, improving and dealing with social determinants of health, which is a major stumbling block around the United States of America, and that the collaborative efforts that will become almost mandated, if you will, by boards that oversee organizations. And perhaps they could take pieces and parts of the work that we're just beginning to do, but this will be part of, if you will, the DNA of organizations, nonprofit organizations going forward, because number one, it'll be our duty to do those things. So I hope that 5 years from now, everything that Tom had mentioned had not only begun to occur, but it became standardized, if you will, operating structures of nonprofits around the United States. And it was, if you will, mandated or encouraged by the boards that oversee these organizations.
Yeah. Well, Tom, Cliff, I want to thank you so much for having such an open and honest conversation with me. Before I let you go, I do have one final question, and it is the same question that I ask at the end of every podcast that I host on Radio Advisory. You two are veterans of the pod, so you know what is coming. When it comes to partnership, when it comes to this conversation that we've had, what is the one piece of advice, the one action item you want the folks listening to this interview to take away and act on, not in the next 5 years, but right now? Cliff, what's your big action item?
If you don't already, reach out and get to know the leadership of the other hospitals in your environment, not simply with a phone call. Arrange for dinners. The goal of that meeting is not to walk away with a blueprint. The goal of that meeting should be to get to know the person, decide and hopefully conclude that there is trust and commonality and purpose between the two persons and the two persons organization, and then let the fruits of that friendship and trust then germinate into something like this. But it starts literally at that level with trust and friendship, and then other things happen after.
Yeah. Tom, what's your action item?
Cliff has said it very, very nicely. So maybe just to add, always assume positive intent. People in healthcare for a reason, always assume positive intent. And when something is just doesn't seem right, it's usually a communication issue. So discuss it early and discuss it openly. And once you have that type of relationship, then everything else is easy to accomplish. And if I may add just yet another thing, it is really, really important to define concrete deliverables and the tasks that you can execute within a reasonable time frame. That is really what gets the collaboration going and keeps it going, because engaging people around the tangible, really motivational outcomes that can be measured is really, really important. And the timelines should be short.
Absolutely. Well, thank you, Tom. Thanks, Cliff. I look forward to watching what your two organizations do over the next 5+ years. With that, we'll go back to you, Mike.
Thank you for having us.
Thank you.
Thank you, Dr. Mihaljvic and Dr. Megerian, for sharing your commitment to collaboration and advancing healthcare and wellness in our community. And thank you to Rachel for moderating today's panel.